Well, good evening, everybody, and welcome to another edition of Ask the Doctor. Tonight we're going to cover on a topic of demolishing diabetes, types 1, 2, and 3. We will have a lot of time for questions and answers at the end, so please type them in the chat so we can get to those as soon as possible. We're going to start our evening off with our amazing guest speaker. Teaches, trains, and lectures doctors all over the world and helps everyone he can. The amazing Dr. Bob Rakowski.
Well, Carol, thank you always for the beautiful introduction, the beautiful friendship, and all the amazing, wonderful value you add to our world. So, as Carol mentioned, I have been in clinical practice now. This is my 31st year, and I'm very blessed to have seen every category of patient from youth to elderly to elite to average. And I've seen a number of cases of diabetes, and I often show the picture of this foot because this foot was given a death sentence. It was scheduled to be amputated 2 days from the day that picture was taken, but you look at it 17 months later and absolutely dramatically improved. So diabetes is now considered the biggest and most expensive problem. I certainly won't call it the healthcare system, in the sick care system. And the fastest growing demographic is actually children. If you could read the fine print from this 2003 Time cover story, it says, Hillary Carroll, 11 years old, has, in parentheses, adult onset diabetes. Well, that's what they used to call it. Adult onset. Juvenile onset was type 1, it was autoimmune, but adult onset, because it didn't happen until much later. But people are so sick, so toxic, so malnourished, and not moving their bodies that this is starting to be a big problem, even for kids. It's more expensive than cancer, autoimmunity, respiratory issues, you name it. And the prices seem to go up every single year. And we're about in 1 in every 7 sick care dollars spent, notice, treating diabetes and its complications. But remember, prevention trumps cure. We'll talk about some of that, but we can also help people, even if they have a diagnosis. And the future, I believe, is pretty bright, even for type 1. So type 1 diabetes, essentially, there's not enough insulin because of destruction of the cells of the pancreas to make insulin, often due to autoimmunity, but it could be a trauma, a physical trauma. It could be a biochemical trauma. There's actually chemotherapy drugs that they stop using because it would actually kill the cells of the pancreas that produce insulin. Type 2, the pancreas can't keep up with the insulin demand because the body begins to ignore insulin. Bodies ignore constant stimuli, and if you're constantly stimulating insulin, eventually it doesn't work as well. And then we actually call dementia or Alzheimer's the type 3 diabetes of the brain. I had a Zoom earlier today, and a guy was diagnosed with type 1.5 diabetes. That's a later onset autoimmune attack on the pancreas. And we might even consider a type 2.5 diabetes. And that's a type 2 that no matter what they do, that's not enough anymore because the pancreas is so worn out and the body's so unresponsive that they need insulin, even though the pancreas could produce it. But insulin is absolutely life critical. And when you look at it, it actually is going to store sugar however it needs to, and that leads to what's called lipogenesis, or the creation of new fat tissue. That's certainly not anything that we're looking for, but also it's involved in protein synthesis and certain other types of nutrients. So it's very important to have insulin work well. And if we go back before insulin was used medically, if people had type 1 diabetes, they were going to die and they were going to waste away. So this young girl, type 1 diabetic before insulin, definitely wasting away. After insulin, put on more healthy tissue and had a much greater probability for a healthy life. When you start looking at blood sugar levels and longevity, what we know is that as sugar increases, death risk increases, and even exponentially at the high end of the spectrum. And the complications are extreme: blindness, kidney failure, nerve damage, vascular compromise that can lead to amputation, heart attack, stroke, even dementia, which we'll show later as type 3. And what I've said for years is that friends do not let friends become diabetic. But the great news is there's wonderful strategies. And I put these PubMeds here because my favorite superfood, part of every diabetic protocol, and not really just every diabetic protocol, but really every protocol I recommend it on, but different medical studies showing that Ganoderma can reverse the complications of diabetes. So now with new nomenclature, Jay Cutler probably would have been called a type 1.5 diabetic. because at age 24, suddenly he started losing weight very, very rapidly, lost 35 pounds. Why? Because he couldn't get nutrients in his cells. He couldn't make proteins. Couldn't even store fat. Believe it or not, you can't store fat without insulin. So you lose weight fast. And rapid weight loss is one of the things that we see in type 1 diabetes. So I always say whenever I give a report of findings to patients or really even talk to doctors, there's 4 questions that patients usually want to have answered. Number 1, what's causing the problem? Number 2, they want to know if I can help. Number 3, how long does it take to get better? Number 4, how much does it cost? We'll go over the causes here, but can I help? I answer this exactly the same every time for every patient, regardless of case. I don't know, but I'll try. And I've got a pretty good track record with a lot of things, especially type 2 diabetes. Believe it or not, and even type 3. Type 1, there's good information on the horizon, brand new information, in fact, that I'll share tonight. How long will it take? Bodies respond to frequency, duration, intensity, quality, and timing of stimuli. And cost depends on how much you do. But I always want to answer 5 other questions. How complicated is the case? How strong and resilient is the patient? Is there anything in the chemistry we need to address? Is there an unresolved trauma or infection, or is there anything else? And diabetes can be, anything from fairly simple, which I've seen it go away in a matter of days, even for a patient that had it for 7 years, to complex. And complex would be, a type 1 diabetic that suddenly their body's not even responding to the insulin that they're injecting. So this was a TED talk entitled Re-Educate the Immune System. And this guy's a pharmaceutical guy. And part of what he says is, our immune system sometimes makes mistakes. And I think he's pretty wrong on that. And I'll share my bias on that. But he said, imagine if you had a kid that had problems reading and made a lot of errors reading. He says, you could blindfold them and they wouldn't make reading mistakes. Now, they couldn't read, but they wouldn't make reading mistakes. And he says, essentially, that's what the pharmaceuticals industry's done by shutting down the immune system. But this is a picture of the pancreas, and this is a normal, what's called beta cell that makes insulin. And this is an abnormal one. And he says, you know what? This actually triggers type 1 diabetes. The immune system will kill the abnormal cell. Well, that's actually what our immune system is supposed to do. It's supposed to kill abnormal cells. So interesting debate, is the immune system killing sick or toxic or injured cells? And it is. There's plenty of good evidence on that. Is the immune system killing the pancreas for no reason at all? No, there's never no reason whatsoever. Remember what the pharma exec showed, dead and dying cells, well, the immune system will kill it, or abnormal cells. So people often say, I don't get this. I thought my immune system was designed to protect me, and it absolutely is. And New England Journal of Medicine recognizes that autoreactivity, or immune action against yourself, is physiologic, a normal part of physiology, and crucial to normal immune function. Why? Because we have cells that get sick. We have cells that mutate, and therefore we want to kill those bad cells. So I often talk about, immune system is supposed to recognize your tissue and recognize things that aren't your own. So the classic example is, let's say you had a friend that needed a pancreas or a kidney transplant. That's much easier. Let's say they need a kidney transplant, and you say, you know what, I've got 2, mine work great, I'll give you one of mine. But understand that this patient will have to take anti-rejection drugs because they'll know it's not theirs. And depending on how far away the match is, the immune system will ultimately kill it anyways. So this journal says relationship between cell injury and autoimmune disease. That's a published medical fact now. The immune system is not going to attack a normal cell, but if it doesn't recognize it, it will go after it. So this graphic here, causes of type 1 diabetes, they fall into these categories: toxins, stress, poor health, poor nutrition, viruses, genetic predisposition. That's what's called out in this diagram. But now there's a very proven link to the gut microbiome, the bugs in our gut. If you have the wrong balance of bugs, you create toxins that can intoxicate the pancreas and even trigger type 1 diabetes. So obesity, certainly a risk factor for autoimmune disease, a risk factor for cancer, a risk factor for type 1, type 2, and believe it or not, type 3 diabetes. gluten and dairy, even in the medical literature, 2020 believed to be triggers of type 1 diabetes. Now, what's my take on that? One man's food's another man's poison. We've known that for thousands of years, but so much gluten has been genetically modified, and these cows are fed a very poor diet, loaded up with hormones and antibiotics. And sick animals produce sick milk, and that certainly can cause issues. Stress is certainly known to increase autoimmunity. 136% increased risk after a pretty significant stressor. If it's significant enough to cause post-traumatic stress disorder, 146% increased risk. So many times I've talked about what I call the stress reset, melatonin, theanine, Ganoderma spores every waking hour. I put the PubMeds there, and this is probably my top clinical intervention over the last decade. And people often ask me, can I do this again? That was just so good for me. And you know what? No toxicity to any of them. So you absolutely can. And here is a very nice diagram of the gut microbiome challenges that happen when it becomes unhealthy. And then they show the pancreas, beta cell destruction, and the onset of T1D. That stands for type 1 diabetes. But within that article, here's what it says. Genetic susceptibility cannot explain the increased incidence of type 1 diabetes worldwide. Environmental factors are there, especially the gut microbiome. So I want you to think about that. We have more bugs in our gut than we have cells in our body. Every bug eats, drinks, and goes to the bathroom. Good bugs eat poop and poop nutrients. Bad bugs eat nutrients and poop toxins. But when we take these antibiotics, against bios life, we kill off the good bugs in our gut. When we are exposed to herbicides, insecticides, fungicides through foods or genetically modified foods, we are severely disrupting the microbiome. And we see a lot more diabetes, cancer, brain problems, autoimmunity, and I think we're beginning to wake up. So when I have a patient with autoimmunity, all the nutrients listed here, the vitamin D, the DHEA, the Ganoderma, perliseid, resolvins, sealing and healing the gut, which will also, by the way, enhance the microbiome. I should really put probiotics in there as well, the right probiotics. Those are strategies that are universally good for the immune system. And I'll give a special shout out to Ganoderma multiple times because it can be used to treat and/or prevent autoimmune disease. STZ was a chemotherapy that they stopped using because it would kill the cells of the pancreas that produce insulin. But interestingly enough, when they gave Ganoderma and that chemo, they were actually able to preserve the cells of the pancreas that produce insulin. So very powerful there. And they can infect the pancreas with Epstein-Barr and trigger type 1 diabetes. But guess what? When they give Ganoderma, Epstein-Barr directly infected into the pancreas does not cause type 1 diabetes. So very, very powerful there. And what I like to tell people is, there has been what they're calling a long-lasting remission. And I use the word cure there of a type 1 diabetes for an individual that had been diabetic for a number of years. But he was actually given what's known as a GABA facilitator. And there are many good ones besides anti-seizure drugs. CBD, theanine, Ganoderma, even meditation are GABA facilitators. But the reason I show Edmund Hillary and Roger Bannister there is, once it's done once, it'll likely be done again and again and again with increased frequency. So this year they had the very first, what they call xenograft organ transplant. They took a heart from a pig and they put it into a human. Now, what they had to do was actually digest out all of the genetic material from the heart. Then they induced stem cells and it actually, matched the individual. So they did this in animals. They had their first human trial. Surgery was successful. The individual lived 2 months and then died. And I tried to find the cause of death, and they actually didn't say it was heart failure. So there's hope on the horizon for using organ transplants. But the reason I mentioned the pig heart is because now they are even experimenting with the pig cells that make insulin, and they're seeing effects in animal trials. So there's a good future, I believe, for people, but you can't do better than your original equipment, right? When we start looking at pathophysiology of type 2 diabetes, there's a liver problem, a pancreas problem, a gut problem, and even a muscle problem. And we'll find out that all these things are important to prevent type 2 diabetes, as they are 1 and 3, but stress, toxins, malnutrition, physical inactivity, you've heard me call it the deadly quartet. And very, very simply, all the stress hormones oppose the action of insulin. And therefore, you can have a stress-induced diabetes. When we start looking at toxins, this is a very good graph where they start looking at, all these chemicals that are relatively new in the environment. We're going back just a little over 60 years for these chemicals really being dominant. But notice the chemical increase exactly matches the diabetes increase. It also measures the obesity increase. And this is more for doctors, but GGT stands for gamma glutamyl transferase. It's how the body gets glutamine into the cell to make glutathione, which is a very powerful detoxification agent. So when you're exposed to toxins, GGT elevates, and they're seeing that as GGT elevates, so does blood sugar. 2020 malnutrition, the leading cause of death on the planet. And here's what we know: the more processed the foods, the more it is likely to spike the blood sugar. That's what glycemic impact means. And also the lower satiety of it. Why? It's not very nourishing. And they even put chemicals in that are designed to promote addiction. So Barry Sears, early 2000s, I was also lecturing at a conference he was one of the keynotes at. He put up a picture of the USDA food pyramid at the time. And he said, if ever there was a terrorist-like plot designed to destroy the health of the world, this would be it. So metformin is the top drug for type 2 diabetes. And you know what? Medicine keeps prescribing this, but there's a big downside to it, which I'll share in a little bit. But fascinatingly enough, Ganoderma, my favorite superfood, works by the exact same mechanism of metformin. Metformin has pages of side effects. Ganoderma has pages of side benefits. 21% failure rate of metformin at 5 years. Here's a couple of the other top diabetic drugs: 1 in 7, 1 in 3 failure. What they keep doing is just adding more drugs to the mix, which certainly can be a problem. When people become diabetic, they start developing what's called a fatty liver. By the way, they also can get a fatty pancreas, and they can get a fatty heart and a fatty body. And that can be especially problematic because it can progress to liver failure and even liver cancer. So there, we'll give a shout out to Ganoderma again in the medical study, showing it's phenomenal for a lot of different liver issues. So Ganoderma has direct action on the islets of Langerhans cells. Those are the ones that actually make insulin, and it even modulates the insulin release. And it can prevent death of those cells and even enhance regeneration. When people have high insulin, insulin says store fat, don't break down fat. White and processed diets tend to do that, whereas a whole food, paleo, keto type diet tends to reduce insulin. But Ganoderma is known to reduce insulin resistance and even promote fat burning by multiple mechanisms. So fun story here about this young lady who lost 57 pounds just by switching to a Ganoderma infused latte. Diana Schwartzbein wrote a really good book, The Schwartzbein Principle. I don't think anybody told her that people buy titles, not content. This was actually a very, very good book. Maybe the subtitle should have been the title: The Truth About Losing Weight, Being Healthy, and Feeling Younger, or Eat Your Way to a Healthy, Sexy, Younger Body. Maybe would have been a better title, but she said, here's the deal. When it comes to hormones that impact blood sugar, it's 5 against 1. 3 stress hormones: adrenaline, noradrenaline, cortisol, and also glucagon and growth hormone, all oppose the action of insulin. So a lot more hormones for than against. And very, very nicely, she said, you know what? The first thing that rises is insulin first after a meal, and then even in the fasting state, then body fat elevates. Insulin says store fat, don't break down fat. Then blood fat, elevated total cholesterol, decreased good cholesterol, increased bad cholesterol, increased triglycerides. And finally, sugar rises. So it's very important to note that if you're testing sugar, you're missing the early markers of pre-diabetes and diabetes. And very, very simply, you cannot store fat without insulin. 90% of people that are type 2 diabetic are overweight or obese, and they even have a term now called diabesity. So the two are absolutely known to go hand in hand. Then you look at 2020, And I don't know how similar this is around the rest of the world, but 72% of Americans gained weight. That's a huge, huge, huge number. I think a lot of people were stress eating and self-medicating with sugar, which does appear to be America's drug of choice. So we'll talk later about the functional food pyramid and how to reverse diabetes and the keto paleo style. But if it's white, keep it out of sight. When we start looking at exercise and diabetes, a single bout of exercise can actually reduce blood glucose. Within muscles, there are what are called exercise responsive GLUT4 vesicles. These actually will draw glucose into the cell independent of insulin. And the harder that you contract the muscle, the more sugar that goes into the cell. Why? Because of powerful muscle contraction burns sugar for energy in the absence of oxygen. We're going to move on to type 3 diabetes or dementia, but this is rising across the globe. And this is a big problem. People's top fear after the age of 55 is actually losing their mind. So it's estimated that unpaid caregivers average more than 100 hours a month looking after seniors with dementia. So it's a big toll on society. So Dr. Dale Bredesen's book, The End of Alzheimer's, he would teach that even when it comes to the cells of the hippocampus that make acetylcholine and store memory, there are 3 distinct zones of cells. There are cells that are dead. There's nothing we can do about that. There's cells that are fine. There's nothing we need to do about that. In between are cells that are functional but not functioning. And by the way, that was the story with this foot. Cells that were dead, nothing we can do about that. Cells that are fine, I don't see any here, but nothing we need to do about that. But in terms of the functional but not functioning, look at the function that we got back in that foot. So here are his 36 categories, essentially, of risk factors known for Alzheimer's. But I think if we really look closely, we could see that stress, toxins, malnutrition, physical inactivity contribute to all of these biomarkers. So the movie Concussion, this was Mike Webster, played 18 NFL seasons, won 4 Super Bowls. This was his character in the movie. He died homeless under a bridge and didn't even know his name. And that's what his brain looked like. And they created a new diagnosis, advanced traumatic chronic encephalopathy. So Ganoderma, my favorite superfood, again, will decrease inflammatory process, swelling, and even breakdown of the nerve tissue after a head or brain trauma. And it can dissolve the plaques and what's known as neurofibrillary tangles associated with Alzheimer's. And a pretty graphic picture here. Words are one thing, but pictures are worth a lot more. These were mice that were given a controlled concussion. One group got Ganoderma and support nutrients, the other didn't. And you can see the difference at just 21 days. Stress, especially super high levels of stress, in this case, Cushing's disease, is strongly associated with breakdown of the memory center. And certain metals and biotoxins created by bacteria, molds, viruses can also contribute to Alzheimer's. And even profound malnutrition is associated with Alzheimer's. And people who exercise the most stay healthier longer. And they even broke down the demographics, people that exercise the most compared to those that the least, almost a 50% reduction in Alzheimer's. So, on this graphic, people can, screenshot it, but keto paleo is what I recommend, superfoods, different types of functional proteins, including whey that can be really, really good for insulin signaling, a good multivitamin, the activated omega-3s, probiotics, and a combination of D3, K2 are all very, very good. And I even give the dosing there that I do for the first 10 days. If someone has neuropathy, I'll give carnitine and lipoic acid as well. And then after that, we do a lesser dose. And I'll tell you what, this protocol, my typical diabetic is non-diabetic in 60 days. And you might notice that there's a lot to this, but here's a fact, diabetes is a big problem. It needs to be reversed. Everyday diabetic is a problem. Every day you get rid of it, you can count on, improving your quality and likely your quantity of life. Donna Mae, fun story. Not a fun story that she had one leg amputated, but a second leg was at risk. Her daughter was at a lecture that I was giving, and she said, wow, I'm going to give her some of that Ganoderma infused tea and capsules. And amazingly, the wound on her foot recovered very, very fast, but her brain also came back. And the doctors at 3 months said that both her diabetes and dementia were in remission. So Ganoderma, again, really, really good for Alzheimer's and really, really good for diabetes, type 1, type 2, and type 3. So that will lead us to questions if we happen to have any.
We certainly do. First one is from Xavius and Devon. Can someone completely heal from diabetes, or will we always be at risk?
Well, type 2, absolutely. Type 3, probably for the lifespan, assuming that, dementia, we're looking at much, much, much later in life. Type 1, they have what's called long-lasting remission. And the reason I showed that data on the transplant is because there's hope. We've done organ transplants for years, human to human. Now they're beginning to realize that they can go from animal to human if they digest out the DNA and infuse stem cells. Now, the research has been going on for about a decade that I know. They did the first successful heart transplant. They've got liver, they've got kidneys. Looks like the beta cells are also under research. So I'm very hopeful, but always remember, prevention trumps cure. So we want to take good care of ourselves and not let this happen.
Okay. How can someone overcome or heal from menopause?
Well, no one needs to heal from menopause. And when we start about overcome, how about maybe the downside to it? Now, if you heard my menopause joke, humor me here, but I don't know why they call it menopause, because women get it too. So your hormone fluctuations and allocation are very, very different than ours. So the ovaries from puberty forward are going to be making the sex steroids, or from puberty till menopause. And then the ovaries completely shut down. And I tell a story about that. I've lectured in Sweden since the 90s. And the Swedish term for ovaries is egg stalkers. And when a baby's in utero, she may have as many as 7 million eggs in her ovaries. But those will decline over time. It's estimated by age 37, a woman's down typically to about 25,000 eggs. By age 52, she's down to no more eggs. No more eggs. The egg stalkers, or the ovaries, close shop. So the ovaries are no longer making the estrogens and the progestins. But the adrenal glands make DHEA. And there's a whole new term called intrachronology. The cells of the body that need the estrogens, the progestins, and the androgens make it. It's made there, it's used there, it's detoxified there. So it was over 15 years ago that a major endocrinologist at a major conference said, therefore, if doctors are testing blood for the sex steroids in a postmenopausal woman, they're really not getting a good picture at all of intrachronology. And so ultimately, we want women to feel good, function good, look good, all the things that you want. And we want to buffer the stress and get the adrenal glands very, very healthy. But DHEA has been described in the medical literature as hormone replacement of choice. There's herbs like black cohosh. There's a very specific strain of Siberian ginseng that's known to reduce hot flashes. What I tell people is, my wife Kelly, she probably doesn't mind me giving away her birthday. She was born in 1965. And she's been in menopause for about 7 years and has never had a hot flash. Now, you might say, well, she has good genetics. Well, I'll argue she certainly does. She has great genetics. But her mother is in her 80s and still has hot flashes. She has a sister in her 60s who's still having hot flashes. Well, what's the difference? Lifestyle choices. And choices are going to be 90 to 95% of our health, genetics 5 to 10%. So is there a place for hormone replacement therapy? Sure. Bioidentical is what we should always use. But when I taught a hormone series in the early 2000s, a researcher named Joe Collins would say estrogens, whether you make them, whether you take them, you need to get rid of them every day. And I tweak that to say estrogens, whether you make them, whether you take them, whether you're knowingly or unknowingly intoxicated by them, whether you're a man, whether you're a woman, you need to get rid of them every day in a healthy way. And the liver has at least 11 different known enzymes to start the process. And then in phase 2, there's something called glucuronidation, sulfation, and methylation. And then there are estrogens and plastics, pesticides injected into animals, and even metalloestrogens. So you notice I went on and on and on that, but you've got to clear the horrible, toxic foreign estrogens from the body and optimize your body's own ability to produce them. And you probably don't want to start at 52. You probably want to start at 22, or maybe even earlier than that, because our world is stressed, toxic, malnourished, and in my book, not physically active enough.
Okay. What can someone do to reduce extreme tiredness and physical fatigue?
Well, we want to know what's causing the problem. And so, they had something that they identified as chronic fatigue syndrome. Well, these people were profoundly toxic. They were profoundly inflamed. They were usually profoundly stressed. And all these things start adding up. And you don't fix it with a magic bullet. You fix it by figuring out what's causing the problem and then unwinding it piece by piece. And almost always the big four are involved: stress reset, toxins, a good detox, malnutrition, the complete pyramid, nutrition pyramid, not just food pyramid, nutrition pyramid, and then reasonable physical activity. But we know when people are profoundly fatigued, hey, what someone fit can do, or even unfit can do, might be very overwhelming for them. So they start out with, let's say it's their goal to do, who knows, 500 steps in a day, in a full day. And that's not much at all. The global average is something like 5,000. But by the way, you need about 6,000 to prevent depression. And once you start feeling better, get that 500 steps in, then, maybe in a couple of weeks, go for 510. And as long as you feel better, 520, 530, 540, if you go up 10 steps a week, then ultimately you can start increasing your intervals, and in time, get your health back. And if you buffer the stress, clear the toxins, address the nutrition, this can likely come faster.
Okay. What is a good approach or protocol for someone with swollen feet/legs?
Well, we're going to figure out what's causing the problem. So there could be a condition called lymphedema, which is damage of the lymphatic tissue, and that's kind of hard to resolve. There could be a kidney issue. There could be high blood pressure. There could be, like varicose veins. The veins, valves are not working, and so there's fluid retention in the lower extremities. But the first question always has to be, what's causing the problem? And then we unwind it. Now, I have seen a few cases of lymphedema, and that's a pretty extreme circumstance, where the lymphatic vessels have been damaged by physical trauma, and you can actually milk the fluid up the leg like lymphatic massage. And I have seen a couple of cases resolve completely, but those are few and far between. Most of the time, they're dissolved, damaged beyond repair. But can you move around? Sure. Can you nourish yourself better? Sure. Can you detox and de-stress? Yes. And all those things I would do. But ultimately, we want to figure out the problem, the cause, and make sure the kidneys are good, make sure the heart is good, make sure the lymphatic system is good, and then dot the I's, cross the T's in terms of health.
Is it unhealthy to eat as soon as someone wakes up? Should they wait a few hours before eating?
Well, oddly enough, today I decided to do a little PubMed search on intermittent fasting, because someone asked, is that good for diabetes? And I was amazed to find that there are over 57,000 studies on intermittent fasting and diabetes. And it goes back a long, long way. And in 2016, intermittent fasting was something that actually was part of a Nobel Prize winning research called autophagy, or how the body clears out bad cells. So to me, I don't care if you eat when you wake up, just make a good choice. And I do want you to learn how to do intermittent fasting. And that might mean, if you wake up, let's use a round number like 7 a.m., well, you probably want to be finished eating, if you're going to eat right away, believe it or not, by maybe 3 in the afternoon. And then you get a 16-hour window of intermittent fasting, which is a pretty good amount for most people. Now, can everybody do that right away? No, some people, they don't have the level, I'll call it, of metabolic fitness, to go days without food. I have now been intermittent fasting for a couple of years, and it's really no issue whatsoever. But here's the simple way: you you expand your fasting window by eating a little later, and start eating a little later and quit eating a little earlier. So what's a little later? Well, how about 2 minutes? Quit eat. Let's say you normally eat at wake up at 7 and you're eating by 7:05. Well, then make it 7:07. But now increase it 2 minutes a day. 7:09, 7:11, 7:13, up and up. So at the end of a month, you're eating an hour later. But what if you also cut 2 minutes on the back end? So, instead of stopping eating at 7, you stop at 6:58 and 6:56. You get an hour on both ends. And so after a month, 2 hours is your increase. 2 months, 4 hours. 3 months, 6 hours. 4 months, 8 hours. And you're probably there. You're probably there with your fasting window.
Is walking for exercise enough to burn glucose?
Well, we don't necessarily want to burn glucose with exercise. And I would say probably not, because glucose is what's known as anaerobic glycolysis. You burn sugar in the absence of oxygen. But aerobic metabolism, fat is the primary fuel source, and walking is aerobic. Now, could you put a backpack on? Could you do a farmer's walk with 100 pounds in each hand? Now, that's a pretty extreme amount of weight. You're probably going to be anaerobic on that farmer's walk. But walking, you're more likely burning fat than sugar. But isn't that the goal? Isn't the goal to become a fat burning machine? You're a lot more efficient with that. So, what I tell people is, you don't have enough sugar even to run a marathon, but you have enough fat, even if you're lean, to run from New York to Los Angeles. So pretty fascinating that, fat is literally that much more efficient.
Okay. Kathy asks, can you explain how Ganoderma spores might help people who have a hard time breathing or with asthma after experiencing the most recent specific illness so many have had?
Well, Ganoderma is known to dilate airways by more mechanisms than prescription inhalers, but without giving away medical confidentiality, I have a guy that I'd absolutely love to have come on and give a testimonial, but he was told he had pulmonary fibroses and that his lungs were screwed, and that, he was going to have very poor quality of life and need oxygen. And, he's down to something like 20%. Well, we put him on Ganoderma spores and other types of proteolytic enzymes. In fact, I might have even given him proteases, lipases, and amylases. And I had him do it every waking hour. And at 21 days, his lung function had improved so dramatically. When he had the follow-up with the pulmonologist, the guy says, well, I guess I was wrong. I guess you didn't have pulmonary fibrosis, because he'd never seen it resolved before. So how fascinating. Can people get better? If you do the right thing, people can get better. So, it does have, so here's what the medical literature says about Ganoderma. It has in it what's known as fibrinolytic proteases. And that can be good for clot busting if it's in the circulatory system. But, if your body absorbs it, it can also break down scar tissue in other locations. So pretty powerful.
How can Ganoderma spores help people who have been bitten or stung by poisonous creatures?
I hadn't looked at any of the anti-venom properties, but there's a number of anti-toxic properties. So when we start talking about venomous creatures, someone, I think it was Casey Nielsen Martin's dog was bit by a rattlesnake, and they had actually put a spore poultice on the wound, and the dog recovered without issue. So that's a pretty powerful statement there. But the hows, let's just say that it's a powerful detoxicant. I guess that's the best thing to do. It clears some of the worst toxins known as the history of the planet, and hopefully toxic venoms as well.
Okay, the next question I believe you've already answered, but I'll ask it in case there's anything else, just in case you have to tweak it. Is fasting a healthy approach for reducing sugar levels, and is it healthy to consistently fast?
Well, the answer is yes. And so here's the interesting thing about that. They had a lot of people that were morbidly obese and diabetic, and they do something called gastric bypass, and they would take the stomach from, maybe the size of a football, and then they make it about the size of a tennis ball. And these people suffer extreme malnutrition and other challenges. But they found that the medical literature says that a week after gastric bypass and dramatic reduction of food intake, diabetes can go away as fast as a week. So reducing your food, improving the quality, all of these things are proven. Now, what's the issue with fasting? Well, you can't do it forever. So, what are you going to eat when you do eat? And here's the simplest rule. If God made it, it's okay. If man made it, stay away. And don't have it, processed. So someone sent me a private message. Can I repeat the products for menopause? So DHEA is available over the counter in North America. I'm not sure about Canada. That's a good question, but it's certainly in the US. And that is, anti-aging and the precursor to the sex steroids. Black cohosh has been known for hot flashes. Ganoderma spores, powerful menopause modulators and helps endocrinology. And then there's a form of Siberian ginseng. And that very specific form is in a product called Estrovera from the company Metagenics. And so, if you need to source those things, I can help. And okay, so one person was drinking Ganoderma infused coffee consistently and taking spores, but still having hot flashes. So add those other things to it and consider endocrinology, etc.
Okay, I have another question here for you in regards to our mocha. When it comes to the first ingredient in the mocha, it's glucose syrup, solids, and veg fat. I hear often that glucose syrup and veg fat are not great and to avoid them. Are they from a cleaner form in this product than what's in processed foods? Can you speak to this?
Well, I don't like those ingredients, but I do like the overall product. And so when you start looking at things, if you analyze ingredient by ingredient, we'd have problems. We wouldn't breathe the air. We wouldn't eat we wouldn't drink the water because there's definitely toxins in there. And I've spoke to Organo about that. So when we start looking at the vegetable fat, believe it or not, one of the things that they wanted to replace it with was MCT oils. And that's on the drawing board. But the biggest challenge is the global supply chain at the moment. When you start looking at the glucose issue, what's fascinating about that is if I have a diabetic patient that wants to drink a mocha, and think about that, would I tell them no? Yeah, of course. I tell them no, don't, avoid sugar at all costs. But that doesn't go very far. These people are getting lots of sugar from lots of different sources. So I'm going to call this a better bad choice. And it's so much better that it could even be a good choice. So what do I mean by that? When we measure their blood sugar before and after, it raises the blood glucose level about the same as a meal of broccoli and chicken. And one of my favorite stories, and it really connected Sachin Patel, who's a practice management guru. I think he consults with hundreds of doctors around the world. But when I was given a lecture in Toronto for him at his practice management group, he said, well, Bob, we're going to put this to the test. So he says, in this group, I want to have a volunteer. And he says, here's what we're going to do. We're going to put a continuous blood glucose monitor on you, and we're going to have you drink a mocha. And let's see what happens over the next 2 hours. Well, the person was not your typical person. It was a healthy, fit, 30-something-year-old male. And when he drank the mocha over the course of 2 hours, his blood sugar didn't even go up a point. And what was fascinating then is all these doctors that had been avoiding sugar, avoiding chocolate, avoiding dessert for a long, long time rushed to the back table, and the mocha was gone, just like that. And from a business standpoint, this is not a business presentation or a business conversation, but there's a thing called the gold pack, which is a big variety pack for people that go, wow, I see the value, I want to build a business. 17 people signed up at a gold pack that day from that event. So they got it. And they said, we're going to share this, right? And that one demonstration built a multi-million-dollar business for Sachin. And you know what? He didn't know the outcome before. I didn't know the outcome before. I was just as surprised as him because I wasn't letting any of my patients have the mocha or the latte. But after that, I said, let's test it. Let's see where it goes. And it's gone in a really good direction.
For anyone who has adrenal fatigue, what have you seen with using these products in regulating adrenal function?
So it's absolutely phenomenal for stress. And in the body, it drives the parasympathetic nervous system. In the brain, it actually is a natural GABA facilitator. By alkalizing the system, it makes every neurotransmitter and every chemical messenger work more efficiently. And by modulating the inflammatory process by over 13 different mechanisms, it's going to give the body a break for the need for cortisol as an anti-inflammatory. So all of these things are really, really good. But one of the things that people ask is, what about coffee and adrenal stress or caffeine? And what's fascinating is caffeine stimulates the adrenal medulla. It stimulates the catecholamines. But what they find out is if you do it consistently over the course of 5 days, the adrenal response is reduced by over 90% after just 5 days. So bodies adapt to constant stimuli. So, there's different ways that we measure stress output, stress function in different people. And here's what we know. These products are quite good for it. So put it to the test. Whatever parameters you want to measure, my first degree is electrical engineering. So measure is what we want to do.
So that's the last question in the chat. So I'm pretty sure Claudio will have one for us to finish us off.
Of course, I'm always counting on it. On coffee enemas, actually, recommending quarterly, semi-annually, it would be most beneficial actually to do it. And how would we benefit from that?
Well, it's case by case. So there's a book called Wellness Against All Odds. And it's written by a medical doctor named Sherry Rogers. And she had a lot of things going on in her body, and in fact, severe ulcerative colitis. And as she says, very, very graphically, you bleed from your backside, your intestines hemorrhage. And she was filling the toilet bowl 10 times a day with blood. Medicine wasn't helping her. So she started looking at natural options, and she beat it. She completely beat this ulcerative colitis. And Wellness Against All Odds was a very early edition. We're talking about a 1980s edition of what ultimately became known as radical remission. And that was the story of 1,700 cancer patients, all who beat cancer when they weren't supposed to. But one of the things that all these people did in their book, Wellness Against All Odds, they did daily coffee enemas. So the primary job of the liver is to detoxify the bowel. And when you put coffee in your backside, it's a retention enema. You're not supposed to dump it out right away like maybe a saline enema. So when the coffee gets to the liver dumps bile and toxins. Now, I have seen cancer patients undergoing chemotherapy drop their liver enzymes 75 points in a single coffee enema. So that's really, really, really powerful. And I'm part of a mastermind group, and there's a woman named Susan Johnson, and I love her. She's brilliant, and she has a passion for helping families beat cancer, because her baby had cancer. I think when her son was 2, he had childhood cancer, and she helped him beat it. And she used essential oils, and she thought that was really, really critical for that. So that's what she does. She's a representative for essential oils, and she teaches family how to use them and make healthier, cleaner choices. But someone asked her, well, what's your daily method of operation? And I thought she was pretty bold to say this. She says, I start every day with a coffee enema. And I thought, you are a brave soul sharing that, and well, God bless you for your courage and sharing, because it probably gives other people permission to do it. But Claudio, the short answer is, who's the patient? What's their goal? So she ultimately realized that it was so good, why not do it daily? I personally think if you're healthy, once a quarter ought to be fine. Just a little bit of house cleaning. But, a cancer patient, daily, maybe even a few times a day.
Nicely put. Always appreciate you. Thank you.
Back at you, my friend.
Perfect. Any others, Claudio?
Yes, I do, but I'm not sure if I should ask this. I have a friend going in for a hysterectomy, and any recommendations? I'm just trying to.
Sure. Well, the better you go in, the better you come out. Right. So, stress reset, detoxify, get the body alkalized, make sure you're moving around. Not every hysterectomy is the same. Some can be pretty complicated, some can be pretty extreme. Some can be, I don't want to say reasonably straightforward, but are they taking the ovaries? Are they taking the uterus? Are they doing all the above? Is there any other reason to do it? And you just keep going on and on. But the simple rule is the better you go in, the better you come out. So, be very, very diligent about everything you do before, during, and after. And it's not too fast afterwards to start detoxifying, and again, Ganoderma is quite good for that. And when you start looking, they will tell people often, stop all your supplements a week in advance. Well, I think that's pretty ridiculous because malnutrition is a big problem, but what are they looking forward? They don't want any increased bleeding or increased clotting. So make sure you're good on your nutrients, be very consistent, then go have a test called PT-INR, prothrombin time with international normalized ratio. The biggest problem with surgery is not bleeding, it's clotting. And so you want to make sure that's in a pretty good range, but you certainly wouldn't want to have a bleeding risk either or a clotting risk, but Ganoderma can prevent the clotting risk.
Okay, we have one more.
I used a different analogy. I gave her the green swimming pool versus
there you go,
the clean swimming pool, and just it's about preparing your environment, right? So if you're going in with a clean environment, you're just going to recover and heal that much faster. So thank you. Love you guys.
Love you back.
Okay, we have one more question that squeaked in under the wire. What products do you recommend for PCOS?
Well, we need to remember that PCOS, the big three, are going to be estrogen toxicity, obesity, and insulin resistance. And so we want to figure out what's causing the problem. Ganoderma is going to be really good for that. And then there's a nutrient called inositol. And they have done studies on PCOS where women were infertile from it and had what they called anovulatory cycles. And inositol reestablished it. And a lot of these women were able to get pregnant just with that. So I like a comprehensive protocol with good diet, good exercise, good stress management, the entire nutrition pyramid, blood sugar friendly, reduce the fat, clear out the toxic estrogens, and put inositol in there for good measure.
Okay, my friends, it's time to thank the man.
Well,
Thank you, Dr. Bob.
Thanks, Carol.
Thank you, Dr. Bob. Thank you, Carol. You're always awesome.